Hello, everyone. My name is Tammy, and today I'll be presenting on a group for domestic violence survivors with an emphasis of strangulation. The group is a specialized group for survivors of domestic violence with or without cases of strangulation, and those community members who have been repeat survivors of violent crimes. What this group will be focusing on is addressing trauma that comes with any type of incident of domestic violence and/or strangulation, any health concerns that the survivors might have after the incident occurred, with or without strangulation, how the agency and the survivor can safety plan together to ensure that the survivor has safe and appropriate locations, that they have appropriate services, and that if their perpetrator is not arrested and or in jail, that they know that they have safe places to go and how to seek help quickly if that's something that they feel like they need because of the threat of a repeat offense against them. The group will also teach warning signs to support survivors, community engagement skills, and the use of resources. In a crisis, people don't always think of where to look for help other than calling 911. So having a piece of paper and the resources on them at all times, or even having an app on their phone so they know who they can reach out to for help quickly, is something that definitely has benefited survivors in the past, and it might be the difference in them keeping safe or something else happening to them. The small groups will meet in person with facilitators who specialize in domestic violence. Medical staff will be on site to address any medical needs or any injuries that might have not been reported that need to be reported to law enforcement, and any other supports as needed, such as other support groups, other members of the group that they might be able to safety plan together, or just share that common bond with one another and form new alliances with each other. The need for this intervention is in 2016 in Tucson, the domestic violence court handled over 1,000 new cases and completed over 1,800 probation review hearings. In 2017, the domestic violence court handled 1,400 new cases and completed over 2,000 probation reviews. Due to the rising number of cases, especially on college campuses, the need to have a specific support group for domestic violence survivors with an emphasis on strangulation is something that this community has seen an increase of. Not a lot of survivors know how to handle these situations without proper resources and supports, and sometimes they don't have safe places to go. So this agency will hire specialized staff to assist survivors in all aspects of domestic violence related incidences and how to protect themselves in the future. Also, community awareness spreads by educating mandatory reporters and the public. There will be specialized classes for anyone who is a faculty member on any of the college campuses and in the high schools, anyone that works in public safety, or anyone that works in the general community that would like some information on the warning signs of domestic violence and how to report incidences that they might see or hear of, but doing it in a way to protect the survivor without shaming or blaming. That will also include working with the college campuses and their security teams to provide those supports to the college students when they need it. The evidence-based relevance to social work interventions. This group will be utilizing an in-person group setting. We find that survivors interact better with each other when they're in person. That way they have a safe space to talk. They know that there is a lesser risk of their offender finding them or being able to listen to their conversation. They might be able to see where they're going, but once they're in the facility, they won't be able to actually get access to them. That way, if a survivor feels like they are being threatened on the outside, they have the supports that they need within the agency. The group's primary treatment type is cognitive behavioral therapy, or CBT. This addresses several mental health needs of the survivor. Not all survivors just have a instant trauma response. It's something that could happen later on. It could be something that triggers anxiety, depression, or any other type of mental illness that comes along with several accounts of being a survivor of a violent crime. CBT also offers changes in behaviors and thoughts of the survivor after a traumatic incident and how to move forward from it. This also helps them to not shame and blame themselves or not to have that guilty feeling if their perpetrator gets arrested, gets sent to prison, or they're no longer able to have access to that person because of an order of protection, or if they choose to move away from that person to keep themselves healthy and safe. The discussion of group evaluation. The agency has decided that group members will be able to complete a survey at the end of each session. This shows the impact of the session, how the survivors felt before, during, and after each session, what they would like to see in the future, and what the agency can do to assist the survivors moving forward. Members will be able to survey themselves at the onset of the services. This kind of gauges the survivor on where they're currently at, where the facilitators need to meet them where they're at, and what the survivors would like to see for themselves moving forward. Again, we don't put any timelines on when survivors, the length of service. They're able to come to the agency whenever they want to receive services. An exit survey will also be requested so the agency can better serve other members in the future. This just leads to another level of intervention where if a member leaves because they feel like they weren't receiving significant supports or sufficient supports, that the agency can do better in the future and utilize that feedback to provide extra resources, different types of intervention methods, or other community resource collaborations as needed. This opportunity gives members some ownership of the materials used in the group, and it makes them feel heard. If members see that what they're asking for is being utilized, then they know that the services are right for them. It is something that the agency can do to further support them and future members. Community collaboration. The more survivors that receive services, the more collaboration with other agencies will be beneficial. We also utilize funding sources from our community members, from donations, from federal and state funding, but we also do community events that shed light on what our program does, how we address our survivors, and what actually goes into working with each survivor from start to finish. The agency will collaborate with specialized medical staff for survivors who might need medical examinations. Also, studies show that group members respond better when the group organizer or therapist is also a community member or shares the same experiences as the survivors in the group. By hiring local community members that also specialize not just in domestic violence or not in strangulation or not in CBT, but they also might be cultural members. They have worked with other agencies in the past to address any cultural competencies needed or wanted. If there are different languages that the survivors are comfortable speaking or understanding, that we have a very diverse group of staff members to address everyone's needs that come through our door. Also, when people have a shared experience, it's also a bond for them. It's a time that each survivor has with each other, and they know where their starting point was, where they're currently at, where they would like to see themselves in the future. All of these put together will provide a comprehensive support group for our survivors, and it also shows that the people that work for the agency also have something else that they might be working on through the support group themselves to further advance their healing process. I thank you all for your time, and that is my presentation for today.